Okay, so another quick tip for the new grads, new nurses, nurses with a year or less of experience. Even if you do have a year or more experience, you're more than welcome to listen, but I'm specifically talking to nurses with a year or less. My name is Zena. I'm your friendly nurse educator. And I am just offering some tips for newer nurses that can help them in their journey into becoming wonderful nurses. So yesterday I talked about you owning your nursing knowledge. Your knowledge is your own and you trusting your own knowledge. So today I want to add to that. I want to say, just because you passed your NCLEX, just because you finished nursing school, the studying should not stop. You should still be studying. You should still be sharpening your knowledge skills. You should be looking stuff up. You should be reviewing things that you're not quite familiar with, that you don't exactly know exactly. And you should be doing that until you are solid in that knowledge. One of the biggest pieces of knowledge you will need is knowing ACLS and BLS. ACLS and BLS should be something that you know like the back of your hand. It is something that you should be able to know and be able to put out on demand. Quite often I hear people say, oh, I don't work in an ICU, so that's not something that I need to know. That is a false statement. If you are caring for patients directly at the bedside, you are their go-to between life or death. So if their life was to stop and you are their primary nurse, it is up to you to activate your ACLS and your BLS skills to save their life. So that is a skill that you need to know. So if you have just recently graduated and you have just recently passed your NCLEX, you need to be studying that ACLS until you know it verbatim, till you know it top to bottom. Then connect with the nurse that's older than you, that's more seasoned than you, to be able to practice those skills until you know the sequence of how everything should go. Doesn't matter if you're in the ICU, doesn't matter if you're med-surg. If you are a nurse caring for a patient directly at the bedside, you need to know your stuff. And ACLS is something that you should know top to bottom. Does not matter what area of nursing you work in. If you don't know it, you need to study it and review it until you do know it. There's so many resources online. There is the American Heart Association training centers. Connect with them and they will help you. If you know me and you want to become better at ACLS, message me, reach out to me. I will help you.